Thank you very much, and I also want to echo the same comments that Senator Moran, and I like some of these ideas you've just mentioned, so I'd be anxious to participate. I know in one of our hospitals in Alaska, they actually give a bonus to employees, pretty significant bonus, up to $10,000 to recruit and retain nurses because of the high capacity and the need. So thank you for offering those ideas. Let me also say thank you, Mr. Secretary, and for the two staff that you sent up to Alaska. I think it was last week or the week before, and the Chairwoman Murray for sending committee staff also. It's important, as you know, and to come up to Alaska to understand what rural is all about, and I know you have been there. Thank you for your visit and your team's visit. It makes a difference to the people there, but it also, I think, opens the eyes to a lot of folks of how we have to deliver healthcare in the most remote rural areas of this country. So thank you for that commitment. Let me, if I can, and I know we have had some conversation, Mr. Secretary, in regards to the idea of the Alaska Heroes Card and the idea of trying to weave through this access issue in parts of the country that have limited access to veterans care. In Alaska specifically, as you know, we talk about the roadless areas. Those areas of 80% of the communities of Alaska do not have access by road. So when we read, and I noted your testimony about Internet Connect and then get the mobile van out there, there's no mobile van possible. The mobile van is in the air, and that's the only way to get it. So I know we have talked in a very positive vein about how to create this access, and I just want to check in with you on kind of the update of that. I know we have kind of talked about the quality of care through our Indian Health Services, which is in superior to so much care that's being given today across the country, and it is high quality care. And tell me kind of where you think we're at this point. I know you've been very responsive. I know we've been badgering you and your team on a pretty regular basis because as you've seen the veterans, all they want to do is go across the street to an Indian Health Service clinic to get their regular checkups as a choice, not as a requirement. If they choose to go to a VA hospital clinic, so be it. But if it's across the street, let's make that happen because the quality of care is equal, or in some cases, we would argue better in certain specialties of the VA. So what's your latest on that?
I think, as you and I have discussed, I think you'll recall that we have put in a policy that would allow veterans from Alaska to go locally and reduce the amount of veterans having to travel to the lower 48. There's a rather robust program underway there. As I described, we're working with the Indian Health Service to establish this MOU, which would open a lot of processes especially for Alaskan Native veterans. But in the meantime, based on my visit to Alaska, the Alaskan Native Consortium, Medical Consortium, we've also established discussions with them and trying to ensure that however the IHS MOU progresses, that we are ready to provide help to veterans who are being seen now in the consortium's.
And you feel that's going in the right direction with the travel consortium?
Let me turn to Dr. Petzel, since his people were up there.
Are there negotiations and discussions?
Yeah.
Okay.
Thank you, Mr. Secretary. Senator Begich, I really do sympathize with what you talk about in terms of the ruralness of Alaska, as well as other parts of the country. While we're waiting for the MOU to be finished, Alaska is one of two places where we are proceeding with tribal interactions, and I'd hesitate to use the word pilot, but to get specific agreements within a tribal unit. In Alaska, I believe it's the Southeast Alaskan Tribal Association, and we are progressing in getting some arrangements made. It would be wonderful, from my perspective, if a veteran could make a choice and access tribal clinics if indeed that was more convenient and the care was the quality that was successful, and that we could work out the reimbursement arrangements. And I think that's what we're trying to do in Alaska, and we have another effort going on in South Dakota to do that.
And you feel, I guess the ultimate question, you feel it's moving in the right direction?
Absolutely.
Excellent.
Absolutely.
The last, I got two quick ones. One is, Senate Bill 914, it's also authorizes a waiver that I've introduced on collection of co-payments for telehealth, telemedicine. I guess the general comment is, you know, I know we have about 200 veterans or so, I think about 100 or so are already in the program in Alaska. I know others across the country. The idea is, especially with mental health services, telehealth is a huge winner in a lot of ways. It actually works very successfully. We've asked that to be waived through this legislation, the copay, so it increases the capacity of telehealth. Can either one of you give me a thought, Secretary, of supportive? I know anytime you take dollars away, but my view is telehealth is just a money saver, and especially the shortage of mental health services, this is a potential way to meld the two problems and create a solution.
Senator, neither Dr. Petzel or I are just familiar with this legislation, so if I may,
Absolutely.
I'll provide that for the record.
Absolutely, and that's on Senate Bill 914, and we'll get you some information on it. The last comment, if I can, Madam Chair, if I can just add to my concern, Undersecretary Hickey, you know, we actually, our last call was Friday from someone who couldn't get through on the 800 number. So it's not old, it's new. And I know when I was chair of the Student Loan Corporation, one of the things we did because we had a call center, as you can imagine, a lot of people upset when their loan rates changed or didn't get their payment in or whatever it might be. So we had to go through a whole revamping of the system, but the metrics we measured by were on a regular basis reported so we could see where the possibilities are. You had mentioned that you are going to have, or you have a system that you can see the metrics of success, wait time, call time, hold time, response, all those. I would want to echo what my colleague on the other side said, that I would really anxiously want to see that, because this is our #1 caseload work, is around VA issues. Second to that within the VA is the 800 number, lack of response or inadequate response, I should say. And that's current, not 6 months ago or a year ago. This is very current, and customer service is the name of the game. How to make sure these veterans have the services they need. Is that something you can provide sooner than later so I can get a better understanding?
I'm going to dive into those numbers today.
Okay,
based on
very good.
testimony.
Thank you, and I think the only solution to your issue on the IT is your whole department should be a 2-year budget process instead of a 1 year and 2 year. That's my personal opinion. So that would solve a lot of problems.